2. In the energy transference between Yuan-source and Luo-connecting points, it is not always necessary to use both points. It is sufficient to use only the Luo-connecting point. This has to be the Luo point of what is deficient. For instance, if there is a yin deficiency and yang excess in the lung or in the large intestine, it is the Luo of the lung, the yin organ, that should be used. Sedation of the yuan source point is used only when the excess proves to be the main problem. If a patient often gets paroxysmal tachycardia, only point heart 5 needs to be used in the intervals. But in the acute episodes, very young, you need to do SI for sedation and heart 5. Now let's have this example. Excessive spleen dampness, so very yin, and deficient functional qi. So as you can see that in the tower diagram, the yang is very deficient. Symptoms: because of the yin, increased yin, there is edema of the face, lower arms, and lower legs at the periphery, with stiffness and pain in the joints, mostly in the mornings. Peripheral edema is a weakness of spleen function of circulating fluid. According to their interior relationship, coupled organs have the same picture of imbalance. So, stomach would have the same imbalance. So, treatment. We sedate spleen 3 because if in this case, we have a very excess yin, and we tonify stomach 40, okay? So sedate spleen 3, yuan source point, to sedate spleen yin directly and sedate stomach yin indirectly. Tonify stomach 40, the Luo connecting point, to tonify stomach yang directly and tonify spleen yang indirectly. Okay. The yuan source points are connected to the source of energy for the body. Mother Earth and all nutrients from her is the source of energy. It is therefore interesting to note that in the yin organs, the earth points of these meridians are also their yuan source points. So, using the yuan points will be similar to drawing energy from the organs associated with the earth element in the body. So here we have the yuan source points of yin organs and the luo connecting points of the yang organs. So if you sedate lung 9, that's the yuan source point, okay? This will impact now the Li6, which is the Luo connecting point. So it's basically yuan source points and Luo connecting points. Sedate pericardium 7, okay? Then do something about the tripole warmer 5. Sedate heart 7, and the Luo connecting point Si7. We sedate kidney 3. Then we sedate bladder 58. Sedate spleen 3, then stomach 40, sedate liver 3, gallbladder 37. This imbalance may be in a yin organ or its coupled yang organ. The same points would be used to bring them to balance.